Andrew is one of our health facilitation nurses and Jodee is a speech language therapist. They both work within the LD health support team for LD services. I nominated Andrew and Jodee because they did a fantastic piece of joint working together for a young man who had got some really serious conditions and he's also got autism, and he needed to understand how these conditions were going to affect his body and the surgery that he needed to be able to treat these conditions. They were life-threatening.
Noel was diagnosed with a tumour, a cancerous tumour in his bowel and bladder. And somebody with Noel's condition with learning disabilities and autism and short-term memory problems, he found it very, very difficult to understand what was happening to him. But the doctor unfortunately said that we needed to do something quite urgently because of the way that the tumour had developed. So we had literally about a 5-week window to get Noel ready for surgery, because that was the only option. It was either surgery or palliative care at that time.
Andrew referred me because he needed some support for working with Noel in helping him to understand the information that he was going to need to understand in order for him to have his operation. Social stories and visual pictures often are very helpful for people with autism in understanding processes of what's going to happen next. So you've almost got like a visual timetable there. So
we did a lot of work pre, but most of the work was done afterwards really, just kind of getting him used to his body change and making it a very positive experience for him, because and it had to be very consistent with the staff as well because of his autism. If you said one thing slightly different, it made him very anxious, and he kind of went back to square one. So, but at the moment now, when I saw Noel last week, he's going out doing his photography, which he loves. I mean, that was the main thing that he wanted to do through this whole process, is get back, spend time with his sister and his family, and do his photography, because they're his main loves in his life. So for me, it's a real privilege to be able to do this job and be able to spend that time with somebody, to be able to make that difference. So yeah, and knowing that he can just do all the things that he loves, and we're not going down that palliative route, and he's got a chance of a life now, because, you know, before his operation, you know, we didn't know what the prognosis would be if he didn't have his operation and how long he would live. I mean, it feels really, really good to be, you know, nominated for an award. I mean, it's almost recognition for the hard work that you do.
I think the guys deserve to win the award because this is just a fantastic piece of quality work.
Well, if we won the award, it would be absolutely amazing.